Hello, my name is Melina Portman. I'm the pharmacy intern here today. The situation, we have pharmacy consult for asthma recommendation. The patient is a 27-year-old female with a history of persistent asthma who is complaining of increased asthma symptoms. She has daytime symptoms 3 times a week. She uses her rescue inhaler 3 to 4 times a week and has not using it multiple times per week. She is awakened by symptoms 1 time per week. And her past medical history is persistent asthma for 1 year, as well as generalized seizures that are controlled by topiramate. She is adherent to her inhaler with proper use. I would confirm this by having her show me how she uses her inhaler. No pertinent family history at this time. Social history, she's a former smoker, quit 3 years ago, and also a law student, which could increase stress. Her review system shows lethargy, but no acute distress in the lungs, mild wheezing. And then allergies to gabapentin involving edema, and then her immunizations are up to date. Her current medications are topiramate, 100 milligrams PO tablet twice a day, the Sprintec 28-day pack, 1 tablet daily for her birth control. Ventolin HFA is 200 milligram Accurate, albuterol is the brand name, and it's 0.09 milligrams per Accurate with PRN every 4 hours. Ventolin HFA, or the Flovent HFA PRN, she uses 120 Accurate, fluticasone is the brand name, 0.44 milligrams BID. And then her vitals include temperature of 36.8 degrees Celsius, her pulse is 90 beats per minute, respiratory rate is 18 breaths per minute, 110/72 millimeters of mercury is her blood pressure. She's at 99% oxygen, 158 pounds, 69 inches. Her BMI is 23.3. Her urine HCG test was negative, and she has high red blood cells with all other labs being normal. Her creatinine clearance is 120 with a serum creatinine of 0.8, and she currently has insurance. So per the 2022 GINA report for adults and adolescents 12 years and up, she is currently on a low dose ICS LABA or a medium dose ICS. So I moved her up to step 3. She's only having symptoms 3 times a week, which is not most days, but she does get awakened 1 time a week by her symptoms. The guidelines led me to qualify her as step 3, as well as uncontrolled, because she said she had 3 to 4 symptoms in the past 4 weeks on the asthma symptom control per the guidelines. The patient was on a low dose ICS, and I would move her up to step 3. The goals would be to decrease her asthma symptoms. So for the recommendation, I would recommend budesonide formoterol, which is also Symbicort, 200 micrograms. That's 80 micrograms of the budesonide, 4.5 micrograms of the formoterol. It's a PO inhaler. She's going to take 2 puffs BID twice a day for maintenance therapy. And then I would decrease the Ventolin and the Flovent, and the budesonide can be used as her PRN rescue inhaler. For counseling, it may take up to 2 weeks to see the full effects, and some side effects might include headache, stomach pain, nose, throat irritation, vomiting, and back pain. For the use, you want to make sure to spray 2 test sprays in the air before use, shake well for 5 seconds, rinse her mouth before inhaling. And for safety, we want to monitor for oral candidiasis and upper respiratory infection. Make sure that in order to prevent the oral candidiasis, she is washing her mouth out. And for efficacy, we'll follow up in about a month to check if it's working for her and give it time to take full effect. 3 months monitoring to possibly step down therapy. And what questions did you have for me today?